download all the good you desire. Challenges we have to develop and mental self-discipline to make it a reality. So, we'd like to welcome you this morning. If you're a first-time caller, member of our Billionaire Mastermind family, or a celebrity drive-by you, we want you to know that we esteem and appreciate you. Now I'm going to turn it over to Lady Tycoon to introduce our host and speaker for today, Lady Tycoon.
Good rising family, and welcome to the Billionaire Mastermind Forum broadcast. My name is Karen Preeti, Lady Tycoon, and today we are speaking with Kelly Jones in regard to mind, body, and immunity. Well, Kelly Jones is a powerhouse speaker, passionate advocate, and a bold voice for health justice, whose mission is rooted in the science of psychoneuroimmunology. A graduate of UNC Chapel Hill and a seasoned corporate marketing leader turned community change agent, Kelly brings head and heart to the healing conversation. Her path to PNI began with deep questions about trauma, mental health, and why so many people, especially Black women, go unheard and undiagnosed. Today, Kelly trains nonprofits, lobbies Congress, writes powerful books, and teaches how trauma and stress affect the immune system and the brain. With certifications in neurodiversity support and years of advocacy for trauma-informed care, Kelly works to dismantle barriers to wellness, especially for underserved communities. She's not afraid to challenge systems, and she invites all of us to do the same. She reminds us that healing isn't just personal, it's political, and it begins with knowledge, action, and love. Well, welcome, Kelly. Grand rising to you.
Thank you so much. That was wonderful. I love that person you just talked about. Can I meet her?
Well, yeah, meet yourself. Well, it was great meeting you, and I have to thank Darius for our introduction. Tell me, Kelly, first of all, for some of us that are really not that versed on this, what is PNI?
So PNI is the combination of psychological, neurological, and immunological assessment. Traditionally, what we do is when there is I'm trying to figure out how to do this with my phone. I'm sorry, hold on one second. Can you hear me? Yeah, okay.
Yeah.
Traditionally, when there's a challenge with adverse social behaviors or something that we don't understand in the community, we immediately go to a psychologist or a psychiatrist for an assessment. A lot of times more a psychiatrist than a psychologist. And in order for that psychiatrist to continue treatment, they have to provide a diagnosis. And one of the things that I've been advocating for is psychoneuroimmunology, so that way, instead of just using a subjective assessment from a clinician, and that may be, they'll get insight from peers, or sometimes there's a referral, and sometimes there's even self-reporting that allows them to diagnose, actually using a comprehensive approach of psychological, neurological, and immunological changes. This will provide objective as well as subjective insights. So when we talk about psychological, we know that is basically looking, once again, at adverse behaviors. When we look at neurological, we're actually looking at neuroinflammation and what are the challenges that are going on with your central nervous system as far as a flight or fight response to adverse situations in the environment, pharmaceutical prescriptions, trauma, anything along those lines. And then also what we're looking at is an immunological assessment of what can be the challenge.
Wow. That's, like you said, that is really, really deep, but very important for us to see the difference. But what inspired your journey into that field of psychoneuroimmunology? I'm going to say it right before we end.
Well, it started with my son Noah. When I was pregnant, or just prior to getting pregnant, I wound up contracting Lyme's disease. And on top of that Lyme disease, I took the chickenpox vaccine. I didn't know I had Lyme disease when I took the vaccine, obviously. And I wound up in the ICU and almost died, almost left this earth. And I prayed. I asked God, I said, look, you know what? If there's anything that I have left in me to do for you, to honor you, to glorify you, please allow me to live. And I wound up surviving that. And at that time, I was looking at the news. People were dying from meningitis, encephalitis, all these different things. Well, shortly after that, of course, in order to recover, they gave me prescriptions, etc. Shortly after that, I wound up getting pregnant. And when I went to the gynecologist, I had to tell him about what had happened prior to with me being hospitalized with the Lyme disease and chickenpox vaccine. And he thought that my child might be born with autism. So he said, before, he even consulted me on an abortion and that kind of stuff. He said, but before you make a final decision as to whether or not you're going to keep your child, what I'd like for you to do is to have a sonogram. And that way we can detect whether or not your child has autism. And I was a deaconess at my church, and I got all this information about autism. Autism is this, autism is this, autism is this, autism is this. And I said, no matter what it is, I'm going to keep the child. So we had the sonogram, and what he explained to me is that he was going to be looking at the 5 brain stems, and the 5 brain stems control cognition, your audible skills, your vision, your fine motor, and your gross motor skills. If 3 of those are stinted, then my son could be born with PDD and OS, pervasive developmental disorder, not otherwise specified, but not necessarily autism. But if all 5 were stinted, it would be autism. And then at that particular time, they were looking at severe autism, even along the lines of retardation, with all 5 being stinted. So we had the sonogram, and after having the sonogram, it showed that my son's 5 brain stems were forming normally, everything was fine, etc. I knew that he would be okay. So he was born, everything was fine, laughing, babbling, everything. And then right around 6 months, he stopped talking. And so right around 12 months, he had surgery because he wasn't walking. He was just crawling. And then right around 18 months, even though he was now walking, he still did not have the communication skills that were appropriate for his age, and my major was speech communication, so I knew that. So we went to a psychologist for an evaluation to see if he had developed autism, even though he did not have it at birth. And what the psychologist said to me is that he had PDD and OS. He could not have autism based on the neurological examination that he had, right? But his presentation was PDD and OS. So with all that being said, fast forward, I always fought for my son not receiving the diagnosis of autism because the neurological examination showed that he did not have autism. Later on, I worked with Dr. Joseph Piven at UNC, and he had proven that basically autism can be detected through MRIs and the scanning of the brain, once again along the lines of if the brain stems are stinted, if there's extensive neuroinflammation, then that's an indicator of autism. So I pressed forward with that. And one of the things that I found through all this was that if you're working exclusively with observation and you're working exclusively on, past experience or what's been done, tried and true, that there is a greater chance of human error with the diagnosis. So that was where I pushed. Yeah, right now there is I had mentioned this to you beforehand. Right now there is a challenge with regards to misdiagnoses. There's 7 to 12 million misdiagnoses
Wow.
or medical errors each year. 40 to 80,000 lead to death, fatality. And 56% of these fatalities, 56% of these fatalities are due to gaps in medical history reporting. So we can't put all the onus on a clinician in the sense that if I'm going to a clinician and I'm not giving them the information that they need to contrast or support the direction that they may be going in for a treatment plan, then I may not get the best diagnosis for myself or whomever I'm representing. So I learned that in working with my son. I learned that in working with myself and the cerebral aneurysm, and I had to advocate for that. So I learned over and over again the importance of understanding psychoneuroimmunology, bringing all three to the table to ensure you get the best results. I think I know I explained to you, and I don't know if I'm skipping ahead, but one of the things, I want a little talkative, so you're in trouble now.
I see. That's why I didn't leave you to yourself. So wait a minute. Just one question at a time. So I need to go back. Did you say 7 to 12,000? Wait, 7 to 12 are misdiagnosed. Go back to that. 7 to 12.
So there's 7 to 12 million annual annual misdiagnosis, and they call them medical errors. So medical error could be like not giving you the follow-up treatment that you need, right? Not giving the follow-up exam that you need. It could be prescribing the wrong medication. It could be missing a misdiagnosis, like saying, oh, there's nothing wrong, but then you have to come back again, like a delayed diagnosis because it was missed originally. So, but there are 7 to 12 million annual misdiagnoses, and 40 to 80,000 of them in a fatality. And there's a higher risk with African Americans because we don't go to the doctors as regularly as our peers. There's a greater usage of the ER for. It's been noted that 24% of African Americans use the ER for a primary care physician, and that approximately 40% continue to use the EDR for like follow-up care. So with that,
yeah. So
I
actually saw some of that even just recently myself. So this is very, very, very interesting. Now, how do you see trauma showing up in physical health conditions?
So trauma can be measured or seen for physical health conditions through MRI, urine, cortisol, I can't think, and also gait analysis. So you can measure depression, levels of depression and anxiety through gait, meaning the extension of your gait, like how wide your stance is, and also the speed of your gait. But it has to be something that's progressively tracked. So the reason why is because when you experience trauma, right, when someone experiences trauma, only 5% of people who experience trauma experience PTSD. It's like a very, very low percent. So, when you experience trauma, there's a couple things that happen. Your cortisol levels are elevated, right? Your cortisol levels are elevated with short stints of stress, and short stints of stress are actually good because it helps to activate your white blood cells. It helps to increase your white blood cell count. It helps with managing stress. It helps with just so many different things. It gives you the dopamine level. There's a eustress. Eustress is good stress. Good stress is like the anticipation of a roller coaster ride, or the anticipation. I can do it, girl.
I do love roller coasters. You take me back, like
Peter Piper pickles. But it's that anticipation of stress. It's called eustress, which is like you're getting a gift for Christmas, and the box is underneath the tree, and you're trying to figure out what's in the box. That's eustress. And what happens with eustress and good stress, and even exercise, is that there's a time limitation on it. Like, you kind of know when it's going to end, right? Like the stress of dinner. You know at 6 o'clock dinner's going to happen. So the stress that's built up with like hunger and anticipation dissipates once you receive that. Then there's chronic stress. and chronic stress, which is once again something that needs to be tracked in progression. Like you can't just look at it in an isolated event because realistically, there's 525,600 minutes in a year, right? So there's a whole lot going on within a year's time span. And if you don't have the proper context of stress, it could be skewed. So with chronic stress, what happens is your cortisol levels are either extremely high or extremely low, right? So because they're extremely high or extremely low, it's hard to determine what is normal. So if you're going to measure gait or, if you're going to measure gait, I'll use gait analysis first. You really and truly need a baseline to track the progression. If you're measuring cortisol levels,
What kind of doctor does a gait what type of doctor does a gait analysis?
That would be actually a neurological doctor, or you could do what's the one I'm thinking of? Podiatrist could do it. Yeah, podiatrist. Because what you're doing is you're also measuring the implant of the foot. Like, so if you're walking and you have a stronger stance on your left than your right, if you're walking and you're where you're landing with your feet. So one of the things, I know this is one of those quirky things. My dad and I used to read the encyclopedia, so I love like little quirky facts. One of the times, yes, I am, nerds are us on steroids. So one of the signs of a neurological challenge, and I'm not going to put any particular diagnosis with it, but a neurological challenge is people who walk on their toes. That is I mean, it has been associated with autism, but I won't say autism because it could be associated with autism. It could be associated with autistic-like traits. It could be associated with so many different things. But yeah, whether or not you land, what is deemed normal on your feet can be an indicator of whether or not you have a psychological challenge. We weren't ready for that. I'm sorry. Go back to the question.
No, but it's opening up a lot of stuff because I recently adopted an experience that I'm even having currently right now. And it's really opening my eyes at one particular doctor that I went to that's seeing so many different things that I hadn't been aware of. So this is really, really interesting. So can our immune systems really remember trauma?
God, yes. Yes. Our immune systems remember trauma in different ways. So first of all, it can impact us personally. It can impact the individual. It can impact the way we respond to social behaviors, respond to our social environment with regards to flight or fight, right? So if we remember a traumatic experience, first of all, let me go back. There are multiple phases with regards to traumatic experience and how it is defined or diagnosed, right? So there is an adjustment disorder, which means it's trigger-based. So we remember there's a trauma that stimulates an adverse response, and that adverse response or adverse feeling can last up to 6 months, right? Then there is pervasive depressive disorder. Pervasive depressive disorder. Now that is trauma that continues over a 2-year time period. In order to reach the DSM-5 criteria for it, it has to be over a 2-year time period for adults and 1 year for children. But the body is remembering trauma, and what's happening is it can't habituate that trauma, right? It can't normalize that trauma. And so habituate means like, okay, so you hear fire alarm, right? And the first time you hear fire alarm, everybody's like, okay, gotta go, right? Gotta get to the exit. But once you start to habituate that trauma, what happens is when you hear it, you're like, okay, that's just the school bell. It's going to go off in a couple seconds. You can anticipate, once again, with the anticipatory stress, I can anticipate when it's going to end. And then with regards to the third level, we're looking at like major depressive disorder. And that is because that comes from trauma that has been exasperated and is actually debilitating for us. So that can last. I want to say that's 2 weeks of debilitating disorder. And then there's PTSD, which lasts for, you have to have a month of those PTSD symptoms in order to be classified as PTSD, at least a month. So when you're talking about does the body remember trauma, it can remember trauma in different forms and in different ways, and it can cause different flight or flight responses. Did I answer your question?
What role do yes. What role do emotions play in health from a PNI perspective?
Okay, so PNI, psychological, neurological, and I'm not sure if I got to the immunological part. I'm sorry. So immunology is basically our endocrine system or our immunoglobulin, and basically it measures how well how our antibodies in our system and how well we're able to fight off various infections, viruses, and just everyday challenges, cold, flu, whatever. So with psychoneuroimmunology, the emotional part is the psychological part. And the psychological part is it's self-awareness and psychological. So those are self-awareness is a part of all this too. But with the psychological part, right now, clinicians, and there's a National Suicide Awareness Day for clinicians. It's on September 17th. There is a higher rate of clinician suicide. So for female physicians, it is a 130% higher rate than the general population. For male clinicians, it is a 40% higher rate. 40% higher rate than the general population. So as clinicians are dealing with their own stressors, when you come in, and the average person visits the doctor 4 times a year for 15 minutes, right? So that's 1 hour of, once again, 525,600 minutes a year. So as you go into the clinician with 60 minutes of insight, you have to realize that they are filling in gaps with confirmation bias and cognitive dissonance and all this other kind of stuff, along with the challenges that they may be facing themselves. So one of the reasons for this elevated level of physician suicide is their inability to care for patients or give them the proper prognosis, proper treatment. And part of that is, once again, the gaps in communication. Part of that is not being able to order. 57.4% of medical errors are due to gaps in physicians being able to order the proper diagnostic exams, right? 56% is due to human error, right? I mean, it's due to gaps in communication, like me not fully being able to fully communicate my story, but 57.4% is due to gaps in ordering the right medical examination. And that is all tied up in a lot in insurance and being able to get the proper.
I was about to say that, yeah.
Exactly. If I'm not able to give them, if I'm not self-aware enough to give them the information that they need to order the proper exam, I may not receive the proper treatment plan, the most effective treatment plan, and I may not receive the best prognosis. And the thrust of PNI to support or to elevate the accuracy of the treatment plan is to have the objective assessments of the neurological and immunological components. So that can be, even though things can be skewed and human error can take place, when you have the 3-strand thread along with self-awareness, it reduces the potential impact of the skewed psychological or even primary care analysis assessments.
But I'm wondering now, first of all, how is that rate so much lower for men clinicians than women? You said that women clinicians have 130% higher rate And the men clinicians is only 40%?
Okay. So are you ready for this? Are you ready for this?
Okay.
Okay, men, don't get mad at me. I still love you. I know you can do it. I know you can do it. I got you. I got you. But women have a tendency to be more nurturing and maternal. And so when they're looking at these patients, they're looking to cure the patient. They're not looking for a Band-Aid. They're not looking for a quick solution. They, kind of like they want to hear the totality of it, because once again, they're looking for a sustainable cure, right? Well, with limited information, they can only provide potentially a temporary cure or a Band-Aid. Not temporary cure, temporary response or a Band-Aid solution. So as they see clients' healthcare continuously decline, what do we do as women? We take on the responsibility. It's my fault. What could I have done better? I was the one that was supposed to listen. I was the one that was supposed to care, and I failed.
But many times men don't give enough information, and they barely even tell the doctor anything. Many times that if a spouse is going, and then the wife usually wants to come along because they're going to ask the questions, and the guys just don't tell much. And it seems to me that the doctors, especially in different specialties, should let everybody know, certain guideline questions that's going to help them to diagnose whatever is the issue, rather than expecting the person to come in and just really tell them everything that they need to know. That's going to help them to get on the right path. So why aren't they telling them, like, okay, giving me some guideline stuff that we might not think that's important, but obviously to them, depending on what type of specialty, that they might need that little piece of stuff that we're not even thinking to tell them about. How come, why is that?
So there's a couple things, right? The average physician, primary care,
don't have time,
sees a patient for 15 minutes. They see 100 patients a week. They see 20 patients a day, 100 patients a week, right? So you, no offense, even though you're amazing, Karen, love you, think you're phenomenal, you are one of 100. In a month, you are one of 400. So I am actually just trying to get through the process to get to the next patient. Like, I hear you, but I have to get to the next patient because it's 20 patients, right? And one of the things that I didn't mention with regards to the suicidal. Now, those are completed suicides. We're not even talking about suicidal ideation when I talk about the 130% higher rate for female and the 40% higher for male. But part of the stressors for clinicians is relationships, failed relationships. So if I know that I have X number of hours to see these patients and then get home to my spouse and make sure I maintain my marriage, right? And I take care of my kids, then I do care, but I also have to preserve self. So if you go into that clinician's office and you are not self-aware and you haven't done the research, you, Karen, 1 out of 100, might miss the opportunity to get the best diagnosis.
Well, I definitely come in with a boatload of information and records and everything. I just went to a new doctor, and that's you have to provide, and they say garbage in, garbage out. If we don't give them, reasonable information for them to make the assessment, I can definitely see this not getting the right results and the right diagnosis. So are there daily... Go ahead.
I just want to say part of that challenge is what you deem reasonable may be different from what they deem reasonable, right? Because we're dealing with cultural differences, we're dealing with language differences, we're dealing with so many different things as far as diagnostic criteria. And you have to remember, average age of the physician right now, average age of physicians is 54 years old, right? So if the average age of a physician is 54 years old, that means that they've seen hundreds and thousands of patients, and they have a huge repertoire of what, these symptoms may lead to. So when you walk into that doctor's office, they have, in a very short period of time, based on the notes they got from the nurse, and etc. They have kind of surmised what your condition may be because they only have 15 minutes. They have a huge, once again, like I said, repertoire. And then guess what? If I get stumped, right? If I get stumped on something, and I say, hey, look, you know what? Let me look at that. What am I going to do? I'm going to look in the medical directory, and I'm also probably going to call one of my peers who's all probably 54 or older. So you're dealing with a lot of tradition when you go into a clinician's office. And there are at least 10,000 rare diseases and, many, many, many diseases, many health conditions out there. So you're asking them in 15 minutes to decipher between 20,000 health conditions and which one you might have. That's a challenge.
Oh, what does it mean to be trauma-informed?
So trauma-informed means that you're looking at things from a trauma basis, right? So what actually is causing the adverse social response, right? So what is the trigger? What is the onset? If you can understand what the trigger is, and you can understand the perception of the frequency, duration, and intensity of the trauma, then you can further or better address it.
Frequency, intensity, and duration? Okay.
Mm-hmm. Perception of it. So if I have a high pain tolerance, right, something that may be actually causing injury to me, I may not deem it as something that's causing injury to me. That's a part of the reason why a lot of African Americans are delayed in getting the treatment that they need because, if you fall down and hit your head, it's like, okay, get up. You're not bleeding. You can still walk. You could do that. I interviewed I interviewed a gentleman, and this story I talk about later on. I was talking to a gentleman about me writing a book, right? My book. And he said to me, wow, that explains a lot of things. I said, what do you mean? He said, when I was a kid, I was writing, and I didn't necessarily get along with the people that I was riding with. And one of the kids rode over my head with a bike. And he's 70 years old. And he said, when I went home and I told my parents, they're like, just go on out there and play and stop, making a big deal out of it. Never went to the doctors, never checked up on it or anything, went out and played, had headaches, but just, never really made much of it. Later on in life, I'm 70 years old and I'm easily angered. I get headaches. I don't have the patience with people that I probably could or should. But now that you've explained the residual impacts of trauma and PTSD, I understand it. I had actually habituated the pain as something normal, and I felt as though if I spoke up and told people about it, they would call me a punk. If I spoke up and if I challenged my original belief, that means that I would have to challenge what my parents believed, right? If my parents tell me that speaking up about this is weak, and I speak up against it, and I speak up about it, I'm challenging now what my parents said to me. I respect and honor my parents. If my parents say, be strong and keep going, I'm going to be strong and keep going no matter what the pain is. And what we can do is we can go beyond pain tolerance and beyond our pain threshold, right? So let's say you can handle up to I'll use weight. You can go to the gym and you can lift 100 pounds, right? And one day somebody comes up to you and says, hey, look, you know what, lift these 200 pounds. You say, man, I can only lift 100 pounds. But you lifted 200 pounds. You may be able to lift a portion of the 200 pounds, but lifting that 200 pounds may cause more injury elsewhere. And that's when you go beyond your pain threshold.
Okay. How can caregivers and educators use PNI principles to support children?
Wow. the biggest thing that I've been advocating for is PNI in the school system before a child is given an IE plan to really and truly look at them comprehensively. There's one.
And what's an IE plan? Because you don't talk code, and some of us are like, huh? What's an IE plan?
Individual education program. And so when a child has an adverse social behavior or, physical ailment, something that is deemed out of the norm for their class, right, or for their peers, what can happen is the teacher can make a recommendation to go see the school psychiatrist or to go see a psychiatrist, right? And in going to see a psychiatrist or psychologist, what happens is internal or external, within the school, outside of the school, they take the teacher's note, right? They take the teacher's note, the teacher's bias, and sometimes, I used to teach, so I know this, sometimes the teacher can go to another teacher that works with the kid, and they can share notes and eventually come up with the same belief. So if you do this and you go to 3 different teachers and you all have the same beliefs and you go to the clinician, what is the clinician going to do? The clinician is basically going to echo what has been said by the teachers. But when you start to look at objective results, when you start to look at neuroinflammation, so when a person experiences trauma, emotional, physical, etc., it actually causes, I don't know if I'm going too deep, it actually causes microglia activation. And so that's wherever the trauma is in your brain, the microglia then goes out and extends out, kind of like tentacles, like I don't know, like spaghetti, let's say, like long like octopus tentacles, to try and protect that area that has been injured. And what can happen is it can stay in that area longer than it's supposed to, causing a hyper protective response, right? And so your body becomes is not as much aligned because that area that it left from now has some gaps with regards to protection because it's so much focusing on one particular area. So with that being said, the neuroinflammation can occur and it can impact the 5 brain stems, fine motor, gross motor, audio, visual, and cognition. So with that neuroinflammation, once again, what you want to do is you want to try and reduce that inflammation that is caused by the microglia activation or the trauma, so that once again, those brain stems can be fully extended and you can be in your healthiest state. So that's where the neurological comes in, and that's going to a neurologist, and they can use an MRI to discern, if there's some type of neuroinflammation. And neuroinflammation can be reduced by food. It can be reduced by exercise. Remember, not extensive exercise, but short stints of exercise. It can be reduced by self-awareness, understanding the you should versus I could and I enjoy. But anyway, there are many ways to address neuroinflammation, and it doesn't necessarily have to be a psychological diagnosis. It could just be a impediment that is based on trauma, based on environment, based on something along those lines. It could be based on a drug that you're taking. It could be based on a lot of different things. But once again, just making sure that that neuroinflammation is reduced. And then with regards to immune response, the reason why it's so important to understand that is, and there's a story on my website of a young lady named Amber who had an immunoglobulin IgA, immunoglobulin A deficiency, right? Psychoneuroimmunology. And with regards to that immunoglobulin A deficiency, she developed habits like profanity, nudity, rage, aggression, just all kinds of adverse social behaviors because of that immunodeficiency. So when I talk about deficiency, IgA, we have something called hormonal, 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 you know what I'm trying to say. There we go. Hormonal immunoglobulins, right? And so basically what they do is they're their antibodies that protect our body. Protect our immune system. And so so there are five, because I'm thinking of something else, but I'm trying to stay on subject, but I'm thinking of something that is so powerful, and that comes from parents. But I'm not going to even, if you want me to talk about epigenetics, I'll talk about epigenetics. But when we're talking about, I've been doing this for 19 years. That's why so much just pops out like, okay, this is the direction we're going in. And maybe I should have done the planned speech instead of answering questions. But so when we're talking about, and I'm not going to, I'm not going to say who said I should have done that. But anyway, but when we're talking about the immunoglobulin portion of it, the reason why that's so important is because we have IgA, IgG, IgM, right? And we also have IgD and IgE, but those are completely different with regards to responding to viruses and infections. You're looking at IgA, IgG, IgM. So some people are not born with the appropriate amount of IgA. And IgA addresses your sinuses, your bronchial system, and your gastrointestinal system. And so what happens is when you don't have enough IgA, you face a virus or infection or something along those lines, what happens is your body, instead of using the IgA to just kind of like dust it out like a dust buster, and get it out really quickly, your body then resorts to IgG and IgM, right? So IgM has the strongest amount of like tentacles or attachments, or has the greatest amount of extension, and IgG has it's affinity and avidity, right? So IgG and IgG and IgM. And so what happens is when your body doesn't have enough IgA, it resorts to IgG and IgM. And IgG and IgM then go out and get rid of the virus, because you don't want to keep the virus, right? Nobody wants to keep the virus. So IgG and IgM then go out to combat it. And when they go out to combat it, not only do they destroy the virus, because they're acting like a HVAC system, like they're turbo blasts. Not only do they destroy the virus, but they also destroy healthy brain cells. So if you can work on improving the immune system, and that can be done with steroids, antibiotics, and the most severe cases is plasma exchange or IVIG. If you can work on improving the immune system, then you can also work on improving the response. So a student's response to a student's fight or flight response and fluid cognition may be impaired by any one of those three, not just adverse psychological components. And the thing that I always emphasize is when you're looking at psychological, that's something that I control. I choose to be mean. I choose to destroy. I choose to hurt. I choose to act out. I choose to do this. When you look at a neurological basis, that's when people say, oh, they can't help it. They can't help it because they've got this physical impairment. They've got this physical challenge. They've got this thing that's internal that is causing them. But if we can provide the support to compensate for what's going on internally, then we can assist them. And people start to look at cures versus, with psychological, just medications to kind of shut them up and you know what I mean? Be still in the environment.
Well, I know we have a tight schedule today. So first, there's several questions I definitely want to go back to. However, one before I need to open the lines for any questions, because I know we have many. One is like, are there daily practices that you recommend for improving our mind and body health?
Three things. One, self-awareness. Self-awareness is extremely important because, once again, that does the you should, I could, I enjoy. And once you understand those three and you start to prioritize where that information is coming from, then you can more effectively choose what's going to, your pathway that's going to best suit you, right? So someone may say, I'll give you a quick example. Someone may say, Kelly, let's go out to dinner. Well, I am not a person that enjoys going out to dinner. Like, my mom used to home cook, etc. Going out to dinner is okay, but it doesn't excite me. So after going out to dinner, I'll be like, okay, can we go roller skating or can we go hiking? And they're probably like, what the heck? We just went out to dinner. I'm tired. I'm whatever. But it didn't give me the endorphins or the excitement that I need to feel satisfied. So once again, once you understand that you should, I enjoy, then you're better able to ascertain which one's best for you and moving forward. Number two is I recommend exercise. I recommend proprioceptive exercise. So proprioceptive exercise actually helps to reduce neurodegenerative conditions such as Parkinson's disease, right? So proprioceptive is basically just push, pull, lifting accordingly, right? And also forced exercise. Forced exercise is just a minimal challenge, not overexertion, but just a little minimal challenge, regulated challenge above what you typically or normally do. Those are the two biggest ones. Is just exercise and self-awareness. I'm gonna say are primary ones.
And the other one was, there was a specific type of test that when we were speaking the other day, that you recommend that, even though it may not be covered, but it can help to identify a lot of different things. What was that test again?
Oh, Lord. I'm old. I don't remember. A specific test that comes to uncover something.
Well, I you're alerting me because, my son had a car accident. Actually, he's had two, but one had a bad car accident. He had blood on the brain and glass under his eye and a lot of different things that had happened. And now, years later, and I'm seeing some kind of behavior, and I'm wondering, you're just making me realize that there may be something that jarred as far as, as well as any of us, that there are things that may have happened to us along life that really, and just some of the behavior that we're seeing that comes out, that could be something else, like you're saying, neurological or elsewhere, that there was something that misdiagnosed and missed along the way. And especially with that many millions of misdiagnoses a year, that's pretty scary. Deep. I mean, but with your efforts of time, we'll have to come back to a part 2 soon.
Okay. I was going to say the key thing is looking for a cure or Band-Aid. The key difference between... maybe what I said to you, I think what I said to you was value-based care or functional treatment. And value-based care and functional treatment is just basically PNI. It's the 3 plus the self-awareness. So typically what we do is we do a fee-based care. Fee-based means I go in, I tell you my problem, you give me a solution, you give me a prescription or whatever, and I'm gone. Value-based care is looking at the totality of it. It's looking at the psychological, neurological, and immunological impact of adverse social behavior or, physical challenges or whatever it may be.
Well, definitely gives us an idea that we need to be looking at a whole lot more, as well as giving a lot more information whenever we're going to a doctor or to a professional, because if we're not given the full information, we're not going to get the full cure or find out exactly what we need to help to fix the situation. So thank you for alerting us to that today. And like I said, we'll have to come back to more of this conversation with your essence of time, that I want to be able to get a couple of questions in, and without me doing all of them. So I will halt right here. I have my brain specialist in the room, and we're so happy to have Billionaire Happy in the house. Woo-hoo! How you doing, girl? And she was our original brain person here on our Billionaire Mastermind Forum broadcast. I had to call her in today. Hey.
You know what? Can you guys hear me okay?
I can.
Perfectly.
Okay, great. First of all, Kelly, I just want to tell you, you are my sister from another mister. I love you. I know you just don't know me from a can of paint, but just all of the things you said, and I love geeky people too, because, I just felt like I was always by myself, just wanting to know about the brain and know about how things work and all of these things. But you just did an awesome job. I want to know all about you and your website and all of your information, so I'm sure you're going to probably tell us at the end. But this is so fascinating, and I'm so excited about it.
Wow, thank you.
Well, this breaks up there a little bit simpler, too. So from what you heard Kelly say, to take some of that a little bit, bite-sized pieces a little bit, is there anything you want to break down from what she said?
Well, some of the things that I wanted to add, especially the things that we can do for neuroinflammation, meditation, breath work, even bodies because we hold so much trauma in our bodies and we're not even aware of it. And when we look at ourselves as an entire system, like we say mind, body, spirit, soul, and emotions, but it's still compartmentalized where people just specialize either in the mind or either in the body or just the emotional aspects or just spiritual. But we get to look at ourselves as an entire system, and then we get to take all the information, like I love what she said about being self-aware and about how we have to do the research. We have to know ourselves. We have to know it, and because I'm a big proponent in knowing how things work, starting with ourselves, and then learning from ourselves and learning about how the world works, and just applying that information. And so when we can take time and build this into our day, where we can just take time to be still and take a breath and notice what's happening in our body, notice if our shoulders are up, and we can just tell ourselves to just relax. We are safe because a lot of the things that we are experiencing, especially what's happening now in the world, a lot of us are walking around with a dysregulated nervous system, and we're not even aware of it because we think this is the way we're supposed to do, or we have to suck it up, or we have to be strong. So we get to create and carve time in our day, whether it's first thing in the morning or lunchtime or whatever, but put it on our calendar like an appointment with ourselves where we can just sit, even if we just take a couple of deep breaths. We do this technique that calms our nervous system, which is called calming, where you rub your hands together really vigorously to generate heat, and then you just cover your eyes. Not only is that helping your vision and helping your eyes, but it is calming and soothing your nervous system. Another technique is called tapping, which where you tap on these acupressure points on the top part of your body, like on your face and the upper part of your body, which is going to calm the amygdala, which is going to help with your immune system because, like I said before, all of it and all of us is a system. So anything that we're going to do to be able to help our brain is going to help our body. And anything that we do that's going to help our body is going to help our brain as well as our emotions as well as our spirit. So, I mean, like I said, I think she did a fantastic job and covered a lot of different topics. And she definitely has to come back on the part two, and I hope that I'm going to be available. I just snuck two. I'll be available. I didn't see it until I came into the other room. Like, oh, wait, that's a kid on. But I'm not even in my office. I'm in another location, so nobody can find me. But I hope I'm able, the next time she comes on, I'm able to do it again because this is really delicious. Very, very good. Very delicious. Thank you for helping us break down how it works. What are you saying? I do have one question. I do have a question for Kelly. I like the idea of value-based care, where we're looking at the totality of everything that's happening with us. But how do we determine, or how do we find that type of care? That is so tough. That is so tough. You have to do your for adult clinicians. And what I found is, parents will talk. You just have to find that network of individuals who will talk. And that was kind of the reason why I did my podcast, is because I wanted to find those talkers, those triumphant talkers who will share their story and who will share their resources. But you really have to look to figure out where those functional doctors are. Now, sometimes on the website, they will highlight functional physicians or functional care. You'll know because functional doctors usually, those appointments are usually an hour long instead of 15 minutes long. Yeah, you'll notice from the time difference. But I really recommend working through your network because also some of the people that I interviewed, they worked with people who they thought were functional doctors, and once they got there, they realized that they're not agile. And so when you are with a non-foreign physician, a lot of times what they'll do is they will try to get you to use a common practice because it's quicker, right? It's quicker. It's quicker to get home to my wife. I can get home to my husband. I can get home to my kids. So I always
recommend speaking to people. Now, I know when I was in New Jersey, some of the doctors I went to for my sons were 2 hours away. When I lived in North Carolina, I was traveling to Philadelphia, New Jersey, and DC. So you may have to travel to find the right clinician. There's a young lady who I interviewed her daughter had a concussion, and the concussion actually wound up having her daughter rolled up in a fetal position. And so she wound up going to a clinician in Oregon and a clinician she was in North Carolina, Oregon, and I want to say it was like upstate New York, somewhere. But when she the one with Oregon, it gave her the preliminary information that she needed, which was like the temporary Band-Aid that she couldn't get. But then when she had enough information to then go to the one in New York, and now her daughter is doing well. Her story is on my page too. Phenomenal story. Her daughter is doing well, but she still has certain sensitivities to like rain and certain audible and visual overstimulation.
Mm-hmm. Thank you. Yeah, I have been looking for a functional doctor. This is mainly just for myself. Thank you so much.
All right. Well, let me hear where your lines real quick.
I'm in New Jersey.
Yeah, I'm from New Jersey.
I'm in the Union area. Union, New Jersey is like about 10, 15 minutes from Newark.
Yes, I used to go to Union Marketplace, Boston. I'm from exactly.
Okay, we'll get to the Union going on later on. Keep it moving. Thank you so much for being here. D Terrell, S. Torres, our billionaire, happy in the house. Hey. Thank you so much for joining us today. I definitely look forward to you coming back again and helping to unpack some of what Kelly talked about here. So let me just go ahead and open the lines real quick. Pressing *6 and the 1 key. We'd like to welcome you and return a long vibration every year, each day. If you don't have an opportunity to do that this morning, we invite you to come back again. We are here Monday through Friday, 8 a.m. Eastern Standard Time, including holidays, and definitely like to hear from you. If not today, then do come back another day soon. Let's remember 8 welcome on our broadcast. So take the opportunity to invite someone to join us, whether live or on the replay at 712-432-1085.